Chairman, Honorable Ministers, members of the Presidential Task Force, ladies and gentlemen of the press, I would first of all like to start by again wishing you all the best for this period of Easter, and hope that next year's Easter will be very different. I would like to start by appreciating and thanking the less visible sufferers of this pandemic, those people that have been isolated or quarantined because of COVID. It's not easy to be placed in a location which is unfamiliar, away from loved ones for a long period of time. And in this regard, I would like to particularly mention the issue of privacy and confidentiality, and request that we continue to respect the privacy of those that have been diagnosed with this disease. Repeated breaches of confidentiality, whether it's by putting out the names of those that are positive in the public sphere, or providing detailed description of these persons to enable them to be identified publicly, does not help the pandemic at all. If anything, it drives people underground and makes it difficult for us to be able to test persons. It creates fear in the society, it creates stigma, and overall it destroys what we are trying to do, which is trying to get on top of the pandemic. I must remind all of us that this is a virus that does not discriminate. It could be your neighbor, tomorrow it could be you. It does not discriminate between a rich man and a poor man. If we do not want to be treated unkindly, we should not treat others the same. So my plea to all of us, including our leaders, is to respect the privacy of those that have been diagnosed with this disease. If there's a need to break this privacy for public health purposes, it will be done by the recognized authorities. Secondly, I would like to talk about the issue of testing. I know there's been a lot in the press recently. Part of the reason why we have not proceeded as fast as we can is because of the demand as well. We are not having as much demand for testing in those labs that we have activated. And I'm asking those labs, particularly the labs that have been activated in the last few days, to please put forward processes that would allow them to key in, particularly in areas where there's suspicion of people having COVID. And this does not only include people who have had contact or those who have traveled abroad. It also includes persons with unusual respiratory tract infections, particularly severe respiratory tract infection requiring hospitalization. And I'll ask that those labs that we have activated in the last 1 week or so, please widen their scope when it comes to selection of testing based on our protocol, so that we can have more positives identified and isolated. I also wanted to talk briefly about the need for us to remember those key prevention measures that we have instituted, which includes physical distancing, hand disinfection, respiratory hygiene, and keeping away by isolating, by having reduced social interaction. These measures are particularly relevant for people who are at high risk of severe illness. And this group includes the elderly, those above the age of 70, those with diabetes, those that have immunosuppression such as cancers, and those with chronic respiratory disease. It is important that this group keep away from persons who may have coronavirus, because they are the ones that will end up with severe illness. So if you have relatives that are elderly, please protect them by making sure that you maintain those measures that we have advised to protect them from having coronavirus infection. Because the pandemic will go away. It's not going to stay with us forever. Whatever inconvenience they face now, it's better for them to be alive in the next few months than to break these measures and end up catching the infection and possibly having a pretty awful time and possibly dying as well. Finally, I would like to briefly mention the issue of support to the response, particularly as it relates to private sector. We do appreciate all the support received thus far. Want to re-emphasize that we are looking for donations in kind, especially, but we would like you to get in touch with us if you want to contribute. It will be good that whatever we do aligns with our current program when it comes to the pandemic. There have been instances where donations may not necessarily fit in exactly with the nation's needs. So if you want to contribute in kind, please get in touch with us and we can give you a list of items, commodities, or where we think your donation will have the biggest impact. Thank you very much.